target plane for chamber view.
So I'm having this. I will use Opus now.
Slide to the right.
Okay, let me stop this
slowly.
So I'm scanning into the. Okay, I will turn on the cameras. Can you see my camera? Okay, so I'm scanning. This is the stomach, right? This is a per chamber view, and I will still scanning, and this is a branching artery, could be the pulmonary, and this is the mediastinum. Okay. Can I do the exam into the? Yes, of course I can. So let's say that I already did, but I want to check it in the heart to have a second opinion. Okay. So I will do this. I will take a stick of this. So remember the movements of the heart of the probe that we discussed? Do you remember? So for example, I'm asking you the following. What do you think about the size from horizontal or vertical? I mean, I'm not seeing complete the circumference. That's a problem. The region of interest is not surrounding the baby. But I think that somehow it is a little bit enlarged in the horizontal. So I will rotate it. So this is increasing, decreasing, increasing, decreasing. So you simply stop in the middle. So this is one way, this is the other way, and you stop in the middle. So this is the middle. So now I know that the sides are okay. Now I will do the angling. So we'll angle forward, and I will angle backwards. So increases, decreases in the vertical, increases, decreases, increases. So it's like here. And this is a good plane. This is a good for chamber view because I know that it's very rounded. Now I will press the 5D hard button so to acquire a stick. And Fiona, are you ready?
Yeah.
Okay, Finula, move the cursor, please.
Okay, along this.
Move the mouse.
Yeah, I'm moving. Yeah, okay, I'm moving now, my.
Very good. Like everybody can see that you are controlling everything. Hey, you are in charge. That's excellent. Okay. Wow. So what you need to do now? So this is the cine loop. So just please look at the cine loop. Just do not move the mouse. Just look and look how stable the sweep is. The aorta is always remaining on the same spot. Look.
Yeah.
Remaining. The descending aorta is there. Yeah. That means that the baby is perfectly lying. The baby is perfectly lying, and the acquisition is perfectly stable. So it's a good acquisition. Okay, it's perfect acquisition. Now, click on aorta at stomach button to stop it. Click aorta at stomach.
And how do I just say stop? Will I?
There's a button. No, there's a button. There's a button on your right. On your right hand side.
Oh yeah. Okay. Aorta at stomach.
Okay. Now the system automatically is going to that plane, assuming that in that portion is the aorta, which is true.
Yes. Yes.
Okay. Make a click on the aorta, please. Just in it's in the center. More. Yeah, that's perfect. Do a click. Good. Now the system automatically jumped to the 4-chamber view. So
very good.
You don't need to do anything. You simply need to click on the center of the aorta at 4-chamber. Do a click.
Very good.
In the center. No, it's not the center. That's the center. A little bit to the Look. It was okay, but it was a little bit rightish. See?
Okay.
It was. So please click on the aorta at the 4-chamber view again button. Yes. And mark it in the center of the circle. Good. This marking is critical. Okay, see now the cursor went up Now go to the crux of the heart. So in order for you to know that that is the crux, what I recommend is to grab the plane navigation slider that is below, below, and slightly move to cranial or caudal, a little bit, cranial or caudal, slightly. Okay, that's going back, going the other way. That's okay, keep going, keep going, keep going until you see the aorta, keep going, keep going. Okay, that's 5-chamber view, go caudal, the other way, go the other way, return. Okay, keep going, keep going, keep going, keep going. Okay, that's too much. It's a little bit. That's a position. That's the ideal position. How do you know that this is 4-chamber view? Go to the triangle in blue. Make it pump. Make it beat. Click on the left hand side. There's a little triangle. Click.
This one?
Yes. Click, and just take a look to the valves. So you will see that the valves are beautiful, opening and closing when they are straight at the crux position.
Yes.
For example, go a little bit caudal to ruin it. Move it caudal. Grab the slider and go a little bit caudal, like 4-chamber view, but not more, like that, something like that. Yeah. Now pump it with the blue button, and see now the tricuspid looks like looks like a little bit different, correct?
Yeah.
You agree?
Yeah.
So it's like the movement of the leaflet is not as nice. This is a sign that you are not in the correct spot of the crux, or you have an azimuth issue. Okay. Now go release it and go to the other view. Release it and go more cranial. No, more cranial. Sorry. Yeah. A little bit cranial. Okay. Remember, in your machine, you have a scrolling button that you can do this very nicely and smoothly.
Yes.
Now,
yes.
You need to click on the crux of the heart. So what is the crux of the heart? The crux of the heart is a spot, is a single point where both valves are joining. That's the spot. Click. So put the cross over the wall. Over the wall. The cross is too far from the wall.
Okay.
Yeah, on the wall, and now align the septum, please.
Oh yeah.
Yes. Okay, that's too much. Okay, good. That's the point. Click. Okay. And now, okay, now you need to mark the pulmonary artery. The problem is that it's difficult for you to mark the pulmonary artery. So scan with the navigation. You need to go caudal, actually, because you are too much away from the heart. Keep going. Keep going. Okay, stop. No. Go the other way. Okay.
It kind of looks like it's there.
Yeah, that's it. And now try to find the SVC. SVC is going to be quite difficult. So this is actually it, and this is it. So see, look at the cardiac axis. See the cardiac axis? It's minus. It's a minus 42. This is wrong.
Yeah.
Okay. So yeah. So this is not good. But also, it does have a TGA.
Yes, I saw that.
Yeah, it also has a TGA.
Yeah.
And you can see this by, for example, in this one. Let me do this.
Yeah. In this one, yeah.
So I will do visa here to see what is this. I want to see if this is a vessel without neck vessels and a hockey stick shape, because it supposedly it's the ductal arch, right? So wait a second until it's calculating. Yeah, I'm sorry, I picked a very difficult case. So I want to pick something more like frequent, a pathology for you to mark. But you did good. You did good because you learned all this stuff of the aorta and the four-chamber view, which is crucial.
Yeah.
Okay. Look, it requires a month of practice until you. So okay. So I want you to grab this guy and to move. Okay, in protosystole. Okay. So I want you to see if you can get here. This is the right ventricle. This is the valve. I want to see if this is a structure that branches, hockey stick, no neck vessels. So please scan. Move the visa. Move it. Okay. Keep going. Drag. Okay. Stop. That's a neck vessel connected there. Keep going. Okay, stop. Neck vessel. This is the neck vessel.
Yeah.
Okay, keep going. Keep going. I want to see now the entire aorta very black, fulfilled with blood. Keep going to the right. Okay, it's coming. Okay, stop. Too much. Return. Just a little bit. I think so. So why don't you bookmark this one? No, that's not it. That's not it. It was this one. Okay, you can see better here than here. So you bookmark here. Keep going. Keep going. Keep going. Keep going. Very good. It's coming. Okay, stop. No. Yeah, beautiful. Bookmark. Okay, let's do a number one, but they are quite similar. A little bit different here. So, can you tell for sure that this is a descending aorta? Is coming here, is having a neck vessel. So this is the isthmus. So there is no branch. You haven't seen no branch during your navigation. And it's connecting through the pulmonary valve to the right ventricle. So when we update this, okay, and we put the labels, we see that this is the PA. Okay, so ventricles are inverted. Here, not at this level, not in the heart, within the heart, but at the level of the connections, there is a misconnection. So that means that this is not the ductal arch. This is what I'm saying. It's not the ductal arch. This is aortic arch. This aortic arch. But it says ductal arch. Why? Because it has transposition. Something that could be seen here. Look. Okay, look. Pulmonary artery. See, it's inverted. It's kind of strange. So when we do a visa here, I can see the crisscross here with the visa. Okay, I will go systole. And now please navigate. You navigate and show me the both arteries. Go. Keep going.
I'm not sure it's moving.
No, it is moving. It is moving. Keep going. Keep going. So that's a pulmonary artery branching.
Yes.
Okay, keep
Will I
going.
bookmark that? Yeah. Okay.
Oh, well, no. Yeah, you can, but now I would just want to
Okay.
see.
Okay.
Keep going. I want to see if you can get to the aorta. So keep going. See, you're not thinking. The system is doing it for you. That's it.
Yeah. And there's the aorta. Yes. Lovely.
Yeah. So you don't
Lovely.
need to. Visa is an incredible genius technology.
Beautiful.
But
yeah. So they're so clearly transposed there. That's very good.
this makes the difference in the diagnosis.
Yes.
So to Shall we conclude the session now, because I think it's yeah, we are 15 minutes past.
Great. Great. I just have one question. Sorry, just a small question, Gustavo. Is that so? The system will label this as a pulmonary artery.
Oh, I will tell you. Good question.
Right.
If you please update the diagnostic plane. Yes. Okay. Now look, the system is telling me that this is the pulmonary valve, the P.
Yeah.
But it's
Yeah.
telling me that this is the A, that this is the aorta.
Okay.
So the system is telling me that this is the aorta and this is the pulmonary.
Oh.
So actually, when there is transposition, you may have some issues with the labeling, because when you go here, this will tell you, like, this will tell you that this is the aorta, okay, it's not the aortic valve, it's the pulmonary valve. So I think that, yeah, actually it's a little bit misplaced, this one. Same thing like this. Okay, it's a little bit misplaced. Anyways, the labels may, I mean, the beauty of the labels here is that you will see that they are confused.
Yes.
So
yes.
That's a sign that something is not good. Okay.
Yeah.
And some will fit and some will not. And also because this patient is also, it has a situs problem, then it makes things even worse.
Yeah.
Okay.
Yeah.
I'm sorry. I should pick something more simpler. Okay.
No, that's okay. So presumably then the, part of the analysis is to ensure that the structures that you're looking at are align with the labeling.
Yes.
As it's presented. So that if they don't align with the labeling as it is presented to you by the system, then there's a problem.
There's a sign of possible suspicion. Let's say that.
Yeah.
Possible.
Yeah.
Because the marking also or may mislabel. So you need to be careful on. I mean, everything contributes to raise the suspicion. Okay.
Yeah. Yeah.
So I am delighted of this session. I couldn't be more pleased on you bring me on your attention this late in the UK. But I really encourage you to spread the word that the heart has a possible option, to be assessed, and to make a community. To make a community, we need to have more sessions like this and discuss cases. This is what we need to do.
For sure.